Hey guys, here I am with another edition of Who Are You and What's Your Story? And today I have the distinct pleasure of interviewing Stephanie Berman. I want to add a G all the time to your name. I don't know why. But Stephanie Berman, who is the founder and executive director of the AZIZA Project, which really supports women as they go through issues with their gynecological health, correct?
Correct.
Awesome. So, Stephanie, I'm super excited to get this conversation underway. I really appreciate you being here. Thank you so much.
Thanks for having me. I'm excited to be here.
Yeah, so you don't often hear people starting a project or an organization or call to action around gynecological health, probably because in our society that's a bit taboo. Can you talk to me about why you're so passionate about advocating for this area of health in women?
Well, when you've been dealing with gynecological pain for like 15 years yourself, it kind of comes naturally. You kind of get to a point where you're kind of sick and tired of it being taboo, and you're like, this is enough, it's enough. This is ridiculous. Um, we need to be talking about this so women who are suffering can get the help they need. We need to be talking about this so we can demand better from our doctors. We need to be talking about this so we can demand better from the insurance companies. And I will get into all of that in more detail, I'm sure. Um, but the big thing is that 40% of women will have a complex gynecological problem at some point in their lifetime. So that's like you and four of your friends, or
Yeah.
4 out of 10 of your friends, rather. Um, and that's a lot to not be talking about it. And it's actually more than the whole number of men, women, and children who have diabetes in the entire US. When you actually look at like 40% of the population in the US, as far as 40% of the women living in the US is a higher number than all of those people who have diabetes. And yet we don't talk about it.
Wow. Yeah. I mean, as a woman, I'm pretty out there. So I put myself out. But
Yeah.
there's so much stigma and shame around talking about our bodies that I
Yeah.
can see why it isn't talked about. And yet, if you look at a lot of the ads generated, it's all about male enhancement, male,
Yeah, like
you
how
know,
often do you see a commercial for Viagra and you're like, oh, it's a Viagra commercial again? And yet, like, where's the commercial about the female equivalent? Because there are female equivalents to Viagra.
yeah. Well, I even have a bigger issue that you can be insured for Viagra, yet women are still responsible for paying for their menstrual needs, like
Yeah,
tampons, pads, and things of that nature. So
yeah, the
I
pink
think,
tax.
what's that?
I said the pink tax.
Yeah, I just think, I look, I'm not here to bash on men and what their needs are because I love us all, but I do think that there needs to be more equality when it comes to supporting the overall health of every single person across both genders. So talk to me about a little bit about your story and how you kind of started on this journey of speaking out and up against, the quieting of women's health issues.
Yeah, so like I alluded to, I've been having gynecological pain for like 15 or 16 years now. And maybe even a little longer if you include like the beginning of my endometriosis symptoms. And so it it kind of came to a head, I would say, in 2018 when um my endometriosis symptoms were getting worse. And I basically looked at my husband and I said, hey, if we don't deal with this, I'm going to be like on the couch 24/7 in like a year. Like it's bad. And so we decided, okay, let's figure out what we need to do to figure out if it is endometriosis. I didn't even have a diagnosis at that point, but I'd been in the women's health sphere long enough that I knew what the symptoms were, and I was pretty sure I had endometriosis going on. And um at that point, we were in a position where we had a really unique health insurance situation. We were able to see like the top endometriosis surgeon in the country, on the West Coast anyway. And she, at the time, she was charging like $5,000 a surgery. Now she's charging 10. But that's because if she can't even take insurance for these surgeries because there's no CPT codes for endometriosis excision, which is the gold standard treatment. And yet the insurance companies are not giving the doctors a CPT code because the surgeries are, expensive and extensive, and it's frustrating. So the women can't get the help they need because the surgeons have to charge too much. And then I was able to get my surgery, and we only paid, significantly less than that because of that interesting situation we had. But it was kind of at that point that the idea for the AZIZA project started percolating in the back of my head. After my hysterectomy, because that's what ended up happening, endometriosis excision, hysterectomy, the whole bit. After that, then I had another gynecological pain that kind of rose to the top and started to hurt more. And I told my husband, the spring following my hysterectomy, I'm like, okay, now we need to look into this one and see if we can figure out what's going on here, because I can't continue like this either. And that's the one that we're still kind of fighting a little bit. And actually, it turns out there were two going on at the same time that I couldn't separate them. I thought they were the same. And I ended up seeing a dermatologist for the one, got misdiagnosed with a thing called lichen sclerosis. And through that whole journey of misdiagnosis, I've managed to find this provider in Tulsa, Oklahoma, who knows a ton about female pelvic anatomy. And I was looking through his Instagram, and I'm like, oh my goodness, he knows so much about stuff that can go wrong in the female pelvis. I wonder if he can actually figure out what's wrong with me. And so I reached out to him. This would have been last summer in 2022. And we ended up having a virtual consultation with him in October. And by the next January, so January 23, we were on our way to Tulsa to see him in person and get some treatment. And he was able to accurately diagnose one of the two issues that I was having. And then we're still working on the second. He's got a good idea of what that one might be too. So
okay, let's talk about what's a CPT code for somebody who is totally oblivious, because I don't even know. So I'm curious.
Sorry. So
that's
CPT code is basically a procedure code that the hospital gives to the insurance company, so the insurance company knows what happened to you.
Okay. So you are working with people who are running into issues in that the hospital or i.e. the doctor is unable to get the procedure covered because there's no basically procedure documented in a way for the insurance company to cover that procedure.
We are not quite there yet. To that point of working with those procedures, that's really specific to endometriosis surgery, that there's no CPT code for endometriosis excision. So they have to choose the closest codes they can, but then the insurance denies it for this, that, or the other reason. My dream is to add an endometriosis excision surgery to our AZIZA affiliated doctors at some point. I'm hoping we can do that by the end of 2024. But I'm still working, the AZIZA Project has only been open since January of 2023. So we're still working on procedures like, how do we talk to doctors' offices? How do they talk to us? What procedures do we have in place so that, we're not giving patients the runaround between them and us? And so they're getting communicated clearly by both sides, and both sides are clearly communicating with each other. I'm still working on all of those procedures before we add a bunch of new doctors.
Okay. So what exactly does the AZIZA Project support with?
So right now we're focusing specifically on vulval vaginal issues, the doctor and sexual medicine. So the doctor we're working with in Tulsa is vaginal specialist, and sexual medicine is his specialty. So, and I like to break that down into like 4 areas: dermatology issues, nerve issues, muscle issues, and then hormone issues. So the first 2 patients we've actually helped have been teenage girls that are dealing with menstrual related problems that are probably hormonally caused. And so one, we were able to get a virtual consultation for her. She's from Florida, doctors in Oklahoma. They were able to do a virtual consultation that way. And he was able to give her and her mom like things to look at and Google and take to her local primary care to say, hey, can we test for this? Can we test for that? Whatever. And her mom told me after that consultation, yeah, there were words that he was saying that I wrote down so I could Google them later. So that was good. And then the other one was actually a gal from Tulsa, who was able to go see the doctor in person. So we were able to pay for her first in-person appointment, which is an hour long, and then a follow-up appointment for 30 minutes. So
you're funding these patients being supported in treatment of whatever gynecological issues they're having.
yeah, so the first thing, anytime we get a new patient that comes to the AZIZA Project, the first thing we cover is that virtual consultation or that in-person appointment if they're in Oklahoma, so that they can meet the doctor. The doctor can kind of figure out, okay, yeah, here's some ideas in the virtual consultation. He may end up saying, like he did to me, oh my goodness, yes, you need to come to Tulsa. And if he tells them that, the next thing we cover is their travel, like their airfare and their hotel in Tulsa. So their airfare to get to Tulsa, their hotel in Tulsa, so that they can see the doctor. If we still have funding after that, then we'll help them with Dr. Babb's fees. That's our doctor in Oklahoma. Help them with his fees for their appointment there. And then if we still have funding available after that, then we'll help them with any in-network stuff like labs or hospital fees or stuff like that. So we actually haven't had to send a patient to Tulsa yet. But we are fundraising and trying to get more money in place so that when we do get a patient that needs to go to Tulsa, we don't have to tell her, oh, well, we need 4 months to raise, the $5,000 you need. We want to be able to tell her, hey, let's book you for 2 weeks from today.
So how are you fundraising and acquiring funds to support the project?
It started out with friends and family of mine. I just started telling people this is what I'm doing. And then I joined some networking groups and started telling more people what I was doing. And we started getting more donations. And now I'm actually going after corporate sponsors. So like businesses who feel like women deserve equality in the healthcare space. So that we can get some larger donations eventually too. Like I would love to find a business that can afford to sponsor us for like $1,000 a month. That would be huge. That's $12,000 a year. So yeah, so that's how we're doing it. And I also have a monthly newsletter people can join, and that even if you can't afford to donate to us, joining our monthly newsletter helps us because as part of that corporate sponsorship program, we tell them, hey, we have this many fans on Facebook, we have this many followers on Instagram, we have this many people on our monthly newsletter, we have this many people on, that we're connected to on LinkedIn. So if you can follow us or join our newsletter list, all of those numbers, the higher we can get them, the better it looks, the more likely we're going to be able to get a bigger corporate sponsor.
I love that. So then how do potential patients, how do people find this project in order to get the support that they need? Because as you and I discussed earlier in the conversation, there's such a stigma and such a lack of conversation around women's health that I imagine it's not as easy to find you.
Right. That is why I'm talking to as many women as I can. I mean, men and women, but especially women, because we're more likely to mention to our friends, hey, I'm having this problem. Who's your gynecologist?
Yeah.
We don't do it a lot, but we're more likely to do that. So I'm trying to talk with women, especially to say, hey, we're out here. This is what we're doing. If you think we're a cool project, next time you're having brunch with your friends, just bring it up and say, hey, I ran across this really cool nonprofit. You should check it out. And that way your friends don't even have to tell you if they're having a gynecological problem. If they are, they'll go look at us. And if your friend is like, oh, that does sound like a cool project, I'm going to go check it out. And they come check it out. Maybe they had a gynecological problem and they end up donating $40 to us.
Yeah. Yeah. So I love that. So I guess breakdown for me, I'm just trying to make it really clear for anybody in the audience who may be, oh, I wonder if I would align with this health issue. One, what's endometriosis? And I actually interviewed a woman last month who had such a severe case it actually went into her abdomen and close to her lungs. But
Yeah.
if you could kind of break down what that is for somebody who doesn't know.
So endometriosis is basically inflammatory tissue. I've heard it said that it's like the lining of the uterus grows out into other parts of the body where it shouldn't be, and that's essentially what it is. It's tissue of some sort that is outside the uterus that should not be there. And the only way to get rid of it, actually get rid of it, is to literally go in and cut it out.
Yeah. And so that, as I mentioned, so when that tissue starts to grow outside of the uterine wall, so to speak, what are some symptoms that one would experience with that type of like issue?
Yeah, the biggest one is extremely painful periods, basically lots of cramps, and then everything that flows from that when you're in extreme pain. I've heard of women, curled up on the floor in the fetal position and throwing up, and just because the pain is so severe. You could have, pain down your legs if it's, messing with your sciatic nerve all of a sudden. You know, if it's on your diaphragm, that's probably going to affect your breathing. And that's rare that it does that, but it's possible.
Yeah.
So
And
yeah,
it also impacts the flow, right? The menstrual flow. It makes it bleeding heavier, if I'm not
it can
mistaken.
make it heavier. You might see more clots, but that can also be associated with fibroids as well. Like that's the problem with a lot of these gynecological uh, conditions, whether we're talking about endometriosis or fibroids or yeast infections versus lichen sclerosis versus nerve issues. They all kind of start with similar symptoms. Like fibroids could be heavy periods, can cause pain, but so can endometriosis. And so determining which one is which, really, you need a doctor who's willing to dig to see, okay, fibroids, I believe, can be seen on an ultrasound, but endometriosis can't unless you really know what you're looking for.
Yeah.
And then things like itching is a primary symptom of yeast infections, but it's also a primary symptom of a nerve issue. Like if you get a pinched
Really?
nerve in your pelvis, you can experience itching. I think that's why it's taken so long to diagnose like this second vulvovaginal issue I'm having that has been, it's manifested as this similar to my nerve issue, but the treatment for my nerve issue hasn't helped this other issue. So that's like, okay, now we still need to figure out what's going on here at the skin level. So that's what makes diagnosing these conditions so difficult.
Yeah. And I imagine that's going to be hard because, I mean, for me, intimacy is very important in terms of the health of my relationship with my partner. And when you're having gynecological issues and you're afraid to say something to somebody, sometimes even your partner, because depending on, how open you are with your significant other. I hope everybody's really open, but let's just be honest, that's not always the case. One could feel a lot of shame of not being able to experience pleasure in when having, intimate moments i.e. sex, and or not wanting to participate in sexual relations because of that, and then causing kind of disruption within the relationship because that
Mhm.
is part of the
Yeah,
relationship.
absolutely. And we've experienced that, my husband and I. And so I will say there were some years in our relationship where, yeah, that was off the table because I was in too much pain. But that actually turned out to be a good thing for our relationship because my husband was feeling like, well, every time we're intimate, she's in pain and I don't want to cause her pain. And that's causing her pain is causing me to feel pain.
Yeah.
So once I put my foot down and I said, we can't do this anymore, but we need to figure out why. Um, he was actually kind of relieved a little bit because he wasn't causing me more pain.
Yeah.
And we were able to, take some space. And I even think, those years were really good for our relationship because it forced us to learn to communicate even on a deeper level than we had been. So
Yeah.
it's hard. I'm not making light of that at all. But it was good. And we came out stronger on the other side. And that's part of what makes me so angry for these women that are dealing with these issues in relationships where they don't have a supportive partner is that I've heard so many stories of husbands who left their wives or their, boyfriends who've left their girlfriends over these types of issues because that's not okay. Like,
Yeah. Well, I mean, there's two sides to that. One, do you want to stay with somebody who's not
right.
supportive of where you're at? I mean, I know for me,
Yeah.
no.
Yeah.
But then also, to your point, right? You and your husband were able to experience a deeper intimacy through connection and conversation, which I think is so important in nurturing a whole relationship. Um, that if you can't have that conversation, ask yourself why, right?
Yeah.
And maybe I'm curious, does the AZIZA Project maybe aid in having those conversations with the significant other?
Well, it's really funny you should ask that because if you'd asked me this a week ago, I would have said no. But my husband and I just had a conversation earlier this week, and he told me that he had been doing some thinking about how, oh, I know what it was. So our doctor in Tulsa over the weekend had done a live on TikTok, and we had asked him, are there any resources for husbands who want to support their partners through this sort of pain? And he's like, no, there really isn't. And so I was like, well, husband, I guess it's gonna be you.
Yeah.
So yeah, I basically looked at my husband. I'm like, so what do you think? And he's like, okay. So he's actually working on writing a series of blog posts that will go on the AZIZA website for partners, talking about basically the myths and lies that and expectations, I think is more the word, the expectations that society and we're part of like the evangelical Christian culture, so especially coming out like talking, both sides, secular society has these expectations too, especially like in the workplace and stuff like that, where that get put on men, like, hey, if you don't have kids, then there's been studies out there that men who don't have children don't get raises and promotions at the same rate that men who have children do. So that immediately puts somebody like a man whose wife may be infertile, but he isn't, he's already then at a disadvantage compared to his peers who have children, who may not even be as good at their jobs as he is. But he's not going to get the raises and promotions that he deserves simply because he doesn't have children. So, and then stuff about, well, if you're not able to be intimate with your wife, then you're not really a man and stuff like that. My husband's going to hopefully get this whole series of blog posts written, and we can get them up on the AZIZA website to help men kind of work through these expectations that society is putting on them that simply aren't true.
Well, you know what's so funny? It's something that came to mind, which I hadn't even thought of. But to your point, I'm spiritual, not religious, but I do have a strong understanding. There are a lot of religions with the ideology that you need to serve your man in
Yeah.
whatever capacity. And that does include sexual relations whenever that is
Whenever,
asked.
yeah, whenever he demands it.
Yeah. And so I guess I never even thought about how impactful that is to these women who can't, or they are experiencing significant pain because of the ideology that they're being brought up under.
Yeah, purity culture is a huge problem, especially in evangelical Christian circles, but even like Muslim circles too. You get girls are taught, well, you have to, dress a certain way or you're going to tempt men, and stuff like that, and you have to save yourself for marriage, and then sex will be amazing, and then they get married and it's not. And or they get married and they're still believing those things, but their body is like traumatized, and there's this condition called vaginismus that basically um it slams the, depending on the grade, there's like 5 grades of vaginismus, and like it basically is when the muscles at the entrance to the vagina like spasm shut, and like doctors can actually literally, when they're doing an exam, um they can literally see the muscles closing in on themselves.
Yeah.
um and so that experience of pain with intercourse makes that worse, because it's like if I said, hey Carrie, I'm going to punch your arm, you're going to tense up in
Yeah.
reaction, like just in anticipation of that punch. um and vaginismus is the same sort of thing. um
Which I imagine, here's my thing. So, having studied mental, physical, and spiritual wellness for many, many years, I, I can't help but wonder if a lot of these conditions are a result of trauma that was experienced early on in life and then presents as physical manifestations of that trauma, particularly the one that you just spoke of. I'm a two-time rape survivor, and it took me 20 years to heal my psyche enough to be able to experience pleasure through sexual intercourse, and that was a lot of work, not just physically but also emotionally as well. Well,
for
I'm
sure.
curious what your thoughts are on trauma being, part of the reason why women are experiencing a lot of these gynecological issues.
Oh, it absolutely is trauma. Trauma plays a huge role in it. Like I was mentioning purity culture earlier. That's very traumatic when you get married and suddenly like you're taught, oh, when you get married, if you save yourself for marriage and you get married and then sex is going to be amazing, and then it's not. That's exactly what happened to me.
Yeah.
Uh,
Yeah.
and so I can relate, and that is traumatic to see that happen. And then for women who have have been raped and stuff, that's extremely traumatic too. And even, but it's not even just something as traumatic as rape or purity culture teaching or things like that. It can be as simple as stress can
Yeah.
cause issues. Like if your pelvic floor spasms, that can pinch nerves, and those
Yeah.
nerves innervate, pleasure places, and then that can cause issues. So and you may not even notice that you're tensing your pelvic floor until it's too late, and then you go and get help, and then they start pointing out, oh, this is your pelvic floor, and here's a muscle in your pelvic floor, and they go inside and they touch it, and you're like, oh, and then you realize, oh, every time I get stressed out, I clench my pelvic floor, and every time you do that, it causes your pelvic floor to tighten, and then then you get the cascade of pinched nerves and the whole bit. And so you have to kind of unlearn those unhealthy habits. And that takes time, and it's hard, and you can't do it on your own. You have to find a pelvic floor physical therapist. But I mean, who talks about pelvic floor physical therapy brunch with their friends on Saturday morning? Um, so
Yeah, it's interesting you say that because a dear friend of mine after childbirth
mhm.
mentioned going through that. And I was like, what the heck? I didn't even know that was a thing. But something I love that you are knowledgeable around trauma and stress related um reasons as to why women are experiencing that, because even men who are impotent, right? If you really get down to the weeds, it's because of stress, it's because of the culture, it's because of the narratives, much like you were saying, that they have to produce and be caretakers and perform and all of that. So I'm curious, is there a component of the Aziza project that supports in the mental health and teaching tools and strategies to manage stress and work through ideology, or are you specifically focused on the physical health aspect
We're
of the gynecological issues?
Yeah, we're specifically focusing on the physical health aspect. Our doctor in Tulsa does recognize that the the mind plays a role in what's going on. And I do have a connection that I would love to like at least get her to do some workshops for like Aziza followers and stuff like that. But again, that's probably a project for 2024, 2025.
Yep.
Um, so still coming, still growing. And maybe we'll get to the point of being able to add, like I know of a purity culture coach that, we may add her as a provider at some point to help people work through coming out of like the evangelical circles and the purity culture effects there. And if I come across others that are doing similar things in the secular world, that's great too. So that we
So
can on both sides.
first off, I really want to commend you, because talk about being courageous and brave to kind of break culture and tradition, right? You grew up in it with your family, I imagine, to
Yeah.
be able to say, hey, my health and my well-being is more important than continuing to go along with this ideology that is really detrimental to how I'm experiencing life. So kudos to you. And then how have you been able to take care of yourself while navigating that separation? And I don't know if you're still enmeshed in that culture and this is just part of what you no longer align with, or I'm just curious.
Yeah, so I'm very much still a follower of Jesus. But I do feel like every person is worthy of the healthcare they deserve.
Yeah.
Um, and I really want to help. Like I'm not hiding the fact that, hey, our provider in Tulsa helps transgender individuals. And yeah, a lot of our marketing materials say women, but I mean that in like the broadest sense of the term. I don't want to turn anyone away because they identify as like a transgender man. Or a transgender woman that needs help, or whatever side they're on, whatever body parts they have. If they have gynecological concerns, we will help them.
Yeah.
I'm not discriminating, for sure. It's been a definite challenge, and I think my gynecological challenges have played a huge role in kind of the shifting of even our political views, mine and my husband's, as we've navigated this whole culture of women are supposed to put out or put up or whatever, and I can't. And so my husband really struggled with that because he really grew up in the purity culture. I got a little bit of it, but my husband really got it. And so when we got married and it was a struggle for us, it was hard for him because he did believe, hey, if we wait and then sex is going to be amazing, and it wasn't, and he wrestled with that for a long time. Um
Yeah.
so now he's like almost more passionate about, hey, husbands, we need to be better for our wives. We need to treat them better. We need to like actually look at what the Bible says about men and women in their relationships, and the role of women in the church. Like it's going so far as, we've had conversations about, directions our church was going, and we're like, we don't agree with that. And what do we do? And that's a whole nother story, what ended up happening. And it's turning out really good. But it's been hard.